We'll start at Section 1, opening of the meeting. That will be called to order by the chairman. Section 2, approval of the agenda. 2.1, changes to agenda and approval of agenda. 3, we have no recognitions. 4, no visitors. 5, no administrative personnel appointments. 6, public comment. 6.1, members of the public desiring to address the school board, Form MIS 5241, public input and/or discussion of agenda items. And just for reference, this upcoming board meeting will be the final board meeting that we will actually do phone calls. After the 1st of November, we will be going back to in-person public comment only. And this is based on the direction of guidance from the governor's office regarding public meetings and all. So we'll move down to 7, committee and staff reports. And 7.1 is in-county travel. 7.2 is a quarterly report, short-term facility use contracts and lease agreements under the $5,000 threshold. And then 7.3, quarterly report, service agreements under the $5,000 threshold for internal and budgetary funds. So we'll move down to Section 8, consent agenda. 8.1 will be the approval of the consent agenda. 8.2, approval of the minutes of the workshop meeting of October 8th, 2020. Minutes of the regular meeting of October 12th, 2020. 8.3 will be appropriation of District 2 School Board member capital outlay funds to Okaloosa Technical College for security gates and fencing in the amount of $20,000, presented by Mr. Dewey Destin. 8.4, appropriation of District 3 School Board member capital outlay funds to Okaloosa Technical College for security gates and fencing in the amount of $13,285, presented by Ms. Linda Vanchek. And then 8.5, appropriation of District 5 School Board member capital outlay funds to Okaloosa Technical College for security gates and fencing in the amount of $13,285, presented by Dr. Diane Kelly. 8.6, request to advertise a public hearing for the adoption of a revised job description for Chief Officer, Finance.
Chairman, I was pointing out to Dr. Hale that we left one very important item off of that job description that we should consider.
What's that?
That the applicants be cloned from Rita's DNA.
Absolutely.
Well, you know, it's funny you say that exact words, because when we did the agenda meeting the other day, I said the exact same thing. There's got to be a clone. So.
All right.
Good luck with that.
And for the record, we do have the best CFO in all of the state of Florida, who
Yes.
manages our money very well. Thank you very much,
Amen
Ms.
to
Scowen,
that.
for all you
Yep.
do. 8.7, tag on bid over $25,000, Snap-on Industrial. 8.8, sole source purchase over $25,000, Consulab Edutech Incorporated. 8.9, budget amendment number 1, fiscal year 2020 through 2021. 8.10, monthly financial statement for September 2020. 8.11, invoices to be approved for payment. 8.12, school donations. 8.13, payroll warrant register and accounts payable warrant register for September 2020, totaling $26,116,607.33, and bank transfers for September 2020, totaling $80,000. Excuse me. 8.14, Second Amendment to the Umbrella Agreement for Government Banking Services. 8.15, Emergency Purchase Train. 8.16, Tag on Bid Purchase over $25,000, Office Depot. 8.7, Exempted Purchase over $25,000, estimated figures for Advanced International Certificate of Education and Advanced Placement Examinations. 8.18, Professional Learning Catalog for the 2020-2021 school year. And 8.19, Okaloosa Technical College course adoption for the 2020-2021 school year. Now we're down to Superintendent's Human Resource Recommendations, Section 9. 9.1 and 9.2 will be for information only at the meeting. 9.1 is employees on administrative leave, and 9.2 is deferred retirement option program to drop. 9.3, substitute and temporary employee salary schedule. Dr. Hale, would you like to come up and talk about this?
Yes, sir. Thank you. Good morning, Board. Good morning, Mr. Chambers. Just wanted to let you guys know what kind of the rationale behind why we are bringing this to you today. This is in response to a critical need that we've identified in our schools with regard to fill rates and substitutes. Currently, our current daily fill rate for the month of September was about 66%, which means almost 4 in 10 sub jobs weren't being filled during September, which is creating a stress on the schools, as you can imagine. We've had everybody from administrators, assistant principals, even a principal or two going and covering classes to help supply this need as employees have to go home for whatever reason it is. That's, we had a slight problem last year. Our fill rate for the month of September comparatively was about 84%, so we made some contractual changes for trying to assist with that, some different things we did through MOUs and such with the union, but many of the interventions that we put in place last year we can't do this year because it has to do with combining classes and things like that, which is not prudent in a COVID environment, as you know. We actually have fewer jobs being requested this year due to obviously a smaller in-house staff, but even with a smaller fill rate, with a smaller need, the fill rate continues to be a critical concern. Schools are having a tough time getting their classes covered. The situation is likely impacting students. Support professionals are being taken from their routine responsibilities because they have to go and do substitute responsibilities instead of assisting in the classroom and things like that, as they should be doing. Basically, all the school processes are stressed right now due to the inability to get subs on a daily basis. And like I said, due to COVID, we're not able to do the class splitting things. It was interesting. As I've told you guys before in front of you, we have over 500 substitutes on our sub roster. It's not a lack of subs on the roster. The subs just aren't simply taking jobs right now. And so we went back, HR department went back through the substitute grapevine, so to speak, and polled the substitutes. Why are we having such a difficult time filling these jobs right now? And there seem to be 4 general categories that the responses came into. Many are just kind of waiting to see how the COVID situation bears itself out. They're not willing or unwilling, but they're just unsure. The second category was that they have some responsibility that's preventing them from coming and taking a job, although they're willing. But then the last 2 have to do specifically with pay. The third category was that pay is just generally too low. And then the fourth category is that the pay is just generally too low in this environment. So those were kind of the responses that we got back. And so this proposed supplement that's in front of you is temporary, not retroactive. If approved, it would go into effect the next day for jobs beginning on that day through the remainder of the 2020-2021 school year that we're in now, specifically to do with the COVID pandemic. And just so that you know, the impact for the substitutes themselves for an hourly basis with a $25 daily supplement, basically the non-degreed substitutes would be at about $12.08 per hour, which is hopefully competitive. Some of the responses that we got back from the subs had to do with other jobs that they could potentially take, and that seems to be in line with that for the non-degreed group. And then the extra $25 per day for the degreed substitutes would bring their hourly rate up to $15.36 per hour, which is competitive in that environment too. So it's a carrot, it's bait to put in the water to try to attract some more substitute coverage as we have these needs, because as we know, teachers have to be out from time to time, and we're hoping that this will impact the sub fill rate. So that's what this is for. And I can certainly answer any questions that you might have about the process or why we went to this strategy to an attempt to get some of this coverage.
I'll start over here if there's any questions.
So if this is approved Monday night, will it immediately go in effect?
Yes, ma'am.
Okay, that's fine, good.
Dr. Kell?
No, I think that it's warranted, particularly during the pandemic, and I think that there are a lot of factors impacting this. I think a lot of the substitutes are now staying at home with their children who might be in quarantine or who might be learning online. So
Yes,
that
ma'am.
has definitely impacted us. So I think that it is needed and appreciated.
Thank you. Dr. White?
Well, just, I guess, just to say that I well remember that whenever we could not fill a substitute position at a school, what a struggle it was to try to find available personnel to fill the time, if you will, for that classroom. And I know that this creates a tremendous burden on the schools, and I'm hopeful that this increase accommodates their needs. I would be interested in a follow-up so that we might know how this worked or what else we might need to do. And then I guess the second thing is that getting subs has always been difficult, but in this environment especially difficult, and so certainly I support this particular attempt to resolve that.
Thank you.
Thank you.
And that would be my comment. I would be interesting to see if it helps. I hope it does. I'm not really confident. Many of the subs are retired, older age, and I'm not sure the money is what's keeping them away, but it certainly is a step in the right direction.
Yes, sir, and I appreciate that. And some of the conversations that we've had behind closed doors is that we know what we think we know, but we won't know until we try something. We have to,
That's
and
right.
this is a first step towards trying something a little bit outside of the box.
All right, thank you, Dr. Hale.
Thank
Okay, we'll move down to 9.4, out-of-field report for the 2020-2021 school year. 9.5, employment separations. 9.6, personnel recommendations. 9.7, employee transfers. 9.8, reinstatement, reimbursement of sick leave due to line of duty, illness, injury, medical examination. And then finally, 9.9, leave without pay. Section 10, discussion agenda, if the 10.1 items moved from the consent agenda, if any. And now we are to construction program owners, representatives, business, and Mr. Destin, I will turn it over to you, sir.
Thank you, sir. The only new thing we have is the repairs on the Bay Area Finance Office roof. And we've got a not to exceed price in, and hopefully it will come in under that.
And that will move us to 11.2, program number 6, task order number 10, time and materials task order, emergency remedial efforts, both design and construction for repairs to roof at the Bay Area office, presented by Dr. Bill Smith. Okay, so we'll move down to section 12, information technology seat management contract, 12.1, CACI task order number 2-170, Salto Gate at Okaloosa STEM Academy. And then section 13, Mr. McInnes.
No report.
Okay, and section 14, Mr. Chambers.
Thank you, sir. So a few updates. As many of you know, this week is also School Bus Safety Week, and I think it's also an appropriate time to thank our bus drivers, our bus aides, the transportation department as a whole, who they do an absolutely incredible job each and every day. You know, many of them are out before the sun rises, and they're going home late as well. I think all of us can remember a time where we probably rode the school bus, and that's all I'll say there. But,
How about driving one?
Well, that's one thing I've never had the opportunity to do.
Well, we can
but,
fix that.
But these individuals, as you know, do a great job. You know, in this year of any year is just another opportunity to say thank you to these individuals. I also wanted to say, especially for the public who may be watching, there's documents that we send out over the course of a month. And one of them is the Chronicles of COVID. And I just encourage individuals when that comes out to take an opportunity to read that information. You know, we put that out on our parent email group. We put it out on social media. We put it out on the website as well. And then also our parent connections newsletter as well, which provides different information about the school district. So those are just two bits of information that come out each month that is filled with some good information. So hopefully we have the opportunity to really look at those items, because they do answer some of the questions that are out there and why we do certain things. So And any parents who would also like to be a part of that parent email group, all you have to do is go to the school website in the superintendent's area, and then you'll be able to sign up to be able to get those emails. I think last year we had about 6,000 on there, and this year we have about 15,000 on there. So there's probably another 17,000 to go. I'd like to take this opportunity to also talk about quarantining. And I'm probably going to spend just a little bit more time on this topic. I would imagine right now, school board members, you've probably received communication as it pertains to quarantining. So I kind of want to go through a series of discussions. As you know, yesterday I sent out some information to schools, and I sent out information to parents as well as it pertains to quarantining. So I just want to go back and just talk about why we're here, and we all know that we're dealing with quarantine because we're in this COVID environment. And we also know that quarantining is going to be a direct result of contact tracing. And we know in Okaloosa County that we have contact tracers that we have employed as a partnership with the local Department of Health. And we also know that for somebody to be determined to contact, that person needs to be within 6 feet of an individual for 15 minutes. Now, what is kind of morphed as the school year has started is the 15 minutes has turned into cumulative 15 minutes. And now, even as recent as here this week with CDC guidelines, to be a contact, now it's cumulative for 15 minutes, 6 feet, but over a 24-hour period. Over a 24-hour period. Okay? So that's in addition to, in essence, what's been occurring. Okay? So when you look at the contact tracing, some also say, well, do you have to contact trace as a school district? And the answer is yes, we have to contact trace, and I'm going to go through some things as well. But before I do, quarantining, you hear about the 14 days, and it's 14 days quarantine from the last date of exposure. And that in itself causes some confusion. So we have some students or even employees who might be quarantined for 14 days. Some might be quarantined for 8 days. Some might be quarantined for 6 days. And then some of the confusion that might be out there is, why are we being inconsistent? And some kids get 6, some kids get 8, some kids get 14. I've even heard some kids get less because they're athletes. And that's just simply not true. So to highlight the point that once someone is determined to be positive, and we realize what that date is, then through contact tracing, they're going to go back to that date. And then whatever that date is, let's just say it was October 15th. But now kids have been in school and it's October 22nd. Well, on October 15th, let's just say, the student started feeling some symptoms. They got tested on October 16th. They got the results back, let's just say that Friday. And then we finally figure out that the person is positive. So they go back to either the test date or the date that the symptoms started, whichever we know, and then they go from the 14 days. So a student could have been in school for another 5 days before being determined to have to be a quarantined student. So the dates are never pure, whether it's 14 or whether it's 6 or whether it's 8. So we are at the mercy of when a student tests positive and when we know, and then through contact tracing, they go back to set defined dates and then roll forward the 14 days, if that makes sense. So that's the quarantine. And then we also know isolation. Isolation is going to be 10 days, so isolation meaning you're positive. So why are some students quarantined the 14 days and some just 8 days? So we talked about that, right? So one of the questions, which I'm going to go deeper in a second as well, is who determines the quarantining and who has the right to quarantine? So I do want to say just from the very beginning, So our local Department of Health is the one who will determine who will be quarantined. They're the ones who enforce the quarantine. So the school board, so each of you 5 right here, none of you determine who's going to be quarantined. I, as superintendent, do not determine who's going to be quarantined. That is a function of the Department of Health here locally and a function of the Department of Health statewide. Now, the governor here recently, I think just in a press conference amongst different topics, one of the parts of this press conference was it was stated that healthy students should not be quarantined. So the governor made that statement, and I want you, the school board, to know that after that statement was made, I talked to Dr. Chapman, our local health department. Asked her to also talk to the state health department. I contacted the Department of Education as well and said, where are we? And it was very clear that we're to continue with the quarantining that's in place. In fact, Dr. Chapman emailed me, and I just want to read her response or her statement to me. And she says, as directed this afternoon, and that was Wednesday, October 21st, by the Department of Health Agency Head and State Surgeon General Dr. Scott Rivkees on a CHD COVID-19 weekly call, DOH will stay the course with the isolation of COVID-19 cases and quarantine for close contacts of a case in accordance with the Center for Disease Control and Prevention. This includes a 14-day quarantine for close contacts from their last day of exposure to the case. And I do want to note that if there are questions, there's COVID-19 at flhealth.gov where questions can go to, as well as the COVID-19 call center at 866-779-6121. Also, on our letter that we sent out yesterday, our local health department can also answer some of these questions at 344-0566. So the governor made a statement, and I think that some of those discussions might be being had at the state level as it applies to quarantining. And I know the state Department of Health is having conversations as well. Now, if new information were to come out, we would take that new information and we would adhere to that. But what we also saw here recently is now contact tracing extends 24 hours out as well. So that seems to be going in the opposite direction. What we also know is quarantining do acknowledge that it's causing a disruption to the school function. And we have students who are being put out anywhere from 5 to 6 to 14 days. And optimally, education is not as strong when these students are going home for these periods of time. The best education is going to occur with that teacher in the classroom, and there's not these disruptions. Also, for our teachers and our staff, the disruption is significant, where you're teaching, you're pacing, and now you're sending work home to help students as well. And they're going above and beyond it to do a good job to do so. Then you have the administrators who now their day for the COVID administrator / the principal, their day right now for many schools is consumed with contact tracing. And of course, all of this is done for the safety of our students, the safety of our teachers and staff. I do want to just share just a little bit. So one, to date, from the beginning of the year through the 18th of October, we've had 170 students test positive, which is 0.7%. And we've had 73 staff members test positive, which is 2.1%. Now, you look at our quarantines, We've had on the student side 2,323 for students and 37 for staff. So those numbers, especially on the student side, is a little higher. Now, as you also know, we have established a COVID dashboard on our website. And just to give you just a little information as well, I know I've received some emails, you may have well, or phone calls, and some have said the COVID dashboard isn't up to date this week, or maybe the numbers don't jive. So two things. One, we update the dashboard as soon as we get the information from the Department of Health, as soon as we get it. So for example, the last couple weeks we've updated it on a Monday. It ended up going to a Tuesday. I think last week it was a Wednesday this week. Well, why is that? Because we didn't have the information yet. So once the Department of Health here locally gives us those numbers, then we post it. Now some people say, well, why don't you post your own numbers? Well, what we don't want to have happen is the Department of Health has their numbers, we have our numbers, and then they don't jive. Part of the difficulty also is you have individuals who test positive, so they are a positive, but then when they go retest, they're a negative, so it's a false positive. So some of the numbers change, just like maybe that particular coach at the University of Alabama who was positive and then turned out to not be positive. So some of these numbers change. So we're mindful of that, but once we get the numbers, we update them immediately. So in the information that we put out yesterday, one of the questions says, who has the authority to contact, trace, and mandate quarantining within a school? And I'm not going to read the whole response, but the bottom line there is the Department of Health is the one who mandates quarantining. So the question is, do we have to follow the mandate? We have to follow the mandate and the requirement to quarantine per the Department of Health. And there's a statute, which I think is statute 381.0031, and in there it even gives the authority of the health department that if someone did not voluntarily quarantine it, it's a second-degree misdemeanor. Now that's not a school district initiated misdemeanor. That's within statute. So statutorily, the Department of Health is the one who is given the power, so to speak, the authority, so to speak, to do this, and we are the cooperative group that works with the health department to get the contact tracing done, but they are the ones who quarantine. What starts the contact tracing and quarantine process? I think we all know once a student tests positive, then the contact tracing is going to start. We even have contact tracing that starts over the course of the weekend. Ms. Terry Schroeder, bless her heart, I think she's been working 7 days a week, literally, since the start of school and going through these, and it's important to go through it because of the safety of students and employees. How long does a quarantine last? We already talked about that. It's 14 days, but after the last contact with a positive person. How can I keep up with the numbers of positive cases and quarantine students? We've talked about that. We did implement the COVID dashboard so families can see that information, understanding that it will be posted and updated. It's weekly. You'll see it by school. You also see the overall numbers from the start of the school as well on there. Does the superintendent or the school board have the authority to quarantine anyone? We do not. I know Mr. Destin, sometimes you might want to quarantine someone, but you don't have the ability to do so, so I'm sorry. Will masks or desk barriers keep a student who is a close contact from having to quarantine? So this is the question that I get all the time, and it's being stated that in other counties, maybe they're using masks and they're not having to quarantine. I've had several conversations with Dr. Chapman. If you are wearing a mask or utilizing the desk barrier, you are still going to have to quarantine. You're still going to have to quarantine. And it says, according to the Department of Health, wearing a mask or sitting behind a desk barrier will not keep a student from having to quarantine if they are a close contact. And that's frustrating to parents. That's frustrating to some maybe school employees. But that's the answer that is given, directed by the Department of Health. Now, some would say, then why should we wear a mask, or why should we use desk barriers? Why should we have these shields right here? Well, I think there is evidence as well that it can help stop the spread of transmission. The last thing I'd just like to reiterate, as you know, we've put a number of measures in place. Some of those measures are the strongly encouraging face masks, practicing social distancing, which we've really reinforced with schools, the enhanced cleaning and disinfecting protocols. We've limited social gatherings, as you know. We've altered schedules. We've thinned out cafeterias. So these are just some of the measures that we've taken. Absolutely understand that quarantining can be frustrating. It is. One of the things that I'm tasked with, and I know that you take to heart as well, is keeping students safe and keeping employees safe. But the quarantining has been an interesting topic, and I just wanted to present that information. If y'all have any questions.
Okay, I'm going to start with Mr. Destin, and then we'll work our way around. So, Mr. Destin?
I just want to thank the superintendent for his presentation. Until there is a vaccine or a cure, contact tracing and quarantining are the only weapons we have. And without them, there's no doubt in my mind that brick and mortar couldn't be open. And as it is, as disruptive as it is, the kids that are quarantined, after all, have an opportunity to be online, which is what would happen to them permanently if we couldn't keep the schools open. So we're doing the best we can under these extreme circumstances, and I want to thank him and the staff for going forward with the processes we have in place.
Thank you, Mr. Destin. Dr. White?
Thank you, Chairman. I guess the concern that has been raised is regarding the governor's comment. And of course, that ran head into what we and other surrounding school districts have been doing with quarantining. And so I'd just like to say that our attorney, Mr. McInnes, has helped us immensely with really what amounts to the vast number of executive orders that we have received from the governor regarding COVID-19. And my assumption would be that should the governor wish to implement the no quarantining comment, that it would be a matter of him issuing such an executive order to make that happen. Mr. McInnes, we haven't received any kind of executive order regarding this matter yet, have we?
Not to my knowledge, no, sir.
All right. And I don't think that we've received anything else in writing concerning how the Department of Health would implement such a measure of no quarantining, or how even we would implement that in writing. I don't know that that's been issued yet, or in fact if it even will be issued. But that's kind of how I see this. Sometimes verbal comments might run into practice and the things that we're doing and the things that we've been, really what it, in my opinion, amounts to is we've been commanded to do. And until we have something in writing, like an executive order or some other kind of communication, I think that we're kind of stuck in the spot, if you will, of doing what the health department has directed us to do. The other thing that I think bears information, if you will, to the public is that even though it's a small number, I think, Superintendent, that some of the children that have been quarantined ended up developing COVID-19. Is that right?
That is correct. As of the last count, when it was 1,700 something quarantine students, we had 12 of those individuals develop COVID, and we're waiting on the updated numbers based on the 2,300 quarantine. So 12 from the last count.
And so that bears directly on why we're quarantining, because had we not quarantined, then those students who eventually developed the virus would have been out in the general student population, and the opportunity for greater infection would have occurred. And so, I mean, we really are caught in a tough spot. I know how difficult it is for parents, and how difficult it is really for the faculty and staff of schools not to have their students there when they were there. So it's really a tough spot, and I think, like Mr. Destin said, if we can get to a vaccine or a cure, we'll be in a much better place. But I appreciate all the work that you and your staff, even in light of some of the public comments, have had to deal with, and the job that you're doing with all this. Thank you, Superintendent. Thank you, Mr. Bryant.
Thank you, Dr. White. Ms. Vancheck.
Well, I believe our number one mission as a board and as a district is to keep students safe and to keep our employees safe. We talk about it a lot, and so while the decision to stay with that is not popular, I mean, we have to do it. I mean, we just have to keep our students safe, and it's not easy. It's certainly not pleasant to have to do this. I know that I've gotten calls from parents whose students have gone home more than once, and they're like, my child is healthy, and I've had to have them come home, and I can't imagine that frustration. I know that must be, whether it's academically it's tough, students who are athletes, that's tough, but ultimately it's what we're told is the best way to keep everybody safe. So I appreciate you holding the line on that, because we are following the law, and that is what we're sworn to do, is to follow the law and to keep everyone safe. And as we just have to hang in there until, like you say, we can see this thing coming around to where things are safer for everyone, and we'll be told when we can let those things up. I'm hoping if everyone, essentially plays by the rules, that hopefully this, the COVID will come around, that either we'll get a vaccine or we will be able to move forward. But it's not pleasant. No one wants it to be like this, but we just have to. So thank you and I appreciate you coming quickly with that clarification. I know I placed a call to you, but before I could even get with you, you were coming out with something, and that's great, because of course the public reacts very quickly to something like that, but you did too, and thank you, sir. I appreciate that.
Thank you.
Dr. Kelly.
Well, I certainly appreciate the phone calls and the emails that parents sent, and appreciate the clarity that helps our parents understand who the authorities are and who actually owns that responsibility of directing school districts to have their rules in place, particularly with regard to isolation and quarantine. And thank you for clarifying the differences in those. But I'd also like to make a comment that reiterates something you said, but that underscores what wasn't said, and that is, I've spoken with 2 people of authority over the last couple of days, one even this morning, and as some parents pointed out, and Ms. Vancheck alluded to, we have people who work with or know people who work in other districts and make phone calls to other districts, and as you said, other districts may give different directives, or at least it may appear that way. Well, what I was told, and was my presumption, but I wanted to be absolutely certain before I stated it publicly, is that different districts have different Department of Health officials. Every district has their own Department of Health official with state-level guidance. They all get the same state-level guidance, but each district-level Department of Health official has their own restraints and their own leeway. So with that being said, their restraints are much like a school system. Their restraints are finances and staffing. So that might have the variance from state to state or county to county. But more importantly than that, each Department of Health official, surprisingly, has the leeway to impart his or her own scientific interpretation into their recommended guidance. So that accounts for why it might be conceived as a little bit of difference in guidance from district to district. That was clarity for me, so I thought I would pass that along. So when our parents are calling other districts and they get a little deviance in mask wearing or contact tracing, that is what accounts for that. Okay?
Thank you, Dr. Ellis. And I just have one question, Mr. Chambers, regarding the accumulative 15-minute deal and now 24 hours. So we know we have the children in our classrooms in a 24-hour period in the schools for maybe, 14 hours at the most. So the challenge, of course, is the 10 hours, the 12 hours that they're not at school. How are we going to address that as far as doing the contact tracing and all? And I think the biggest thing is for people out there, if you take your child or anybody in your house to get tested for a COVID, do not send them to school until you get the results back. Please, do the right thing. Keep them home. Keep yourself home until you get the results back, because this is going to be the challenge. How are we going to be able to track them for the time that we don't actually have them in the classroom? And we have to depend on our parents to do the right thing, and the community as a whole. So how are we going to address that?
That's a good question, and I talked to Dr. Chapman about that specifically yesterday, because of course our contact tracing is strictly to the school district, and the school district meaning during the school day and athletic practices or games or extracurricular activities or events. So that's where our arm stops, and then from that point, if there was additional contact tracing, that's where the Department of Health would have to take over. So we do our contact tracing in cooperation with the health department, so they know specifically who the students are as well. So they would have to then take over that next leg to ask those questions of each of the quarantined students or the positive individuals to be able to contact trace beyond our school walls.
So like Dr. Kelly just said, each Department of Health is obviously, there's different practices and how they do things, and financially some health departments might be a little bit more constrained. Ours could be the same way. So when the Department of Health is actually going to take over that time that we can't do the contact tracing, it's going to be handled a lot differently. I believe, if I'm not mistaken, they won't actually go out. They'll just kind of make the phone calls. And is that correct?
That is correct. They place phone calls, and one thing I do want the board to know as well, it's kind of on these lines. I think they're at approximately 62 extra workers at the health department right now. Come January, it'll go from 62 to 2.
We hope.
Yeah.
And
Go ahead, Dr.
Brian, I was just going to ask, just as a matter of clarification, the various health departments in all the different counties, Mr. McInnes, could you let us know who is in fact the agency head for the Florida Department of Health?
Well, the starts at the governor, but the Surgeon General is, I believe, direct
Right.
command over
That's
that
what I
Department of
thought.
Health.
Yes, sir.
And the Surgeon
So-
General answers to the governor.
So the governor then basically directs the Florida Department of Health if he chose to do so.
There is a chain of command there, certainly.
Okay. All right. Thank you.
Thank you. All right. Mr. Chambers, any other comments under your business today?
That is it.
Okay, and I'll just finish off by saying thank you again for all your hard work. I know we talk quite a bit, especially with everything that's been going on and trying to communicate with my fellow school board members, just the things that are going on. And I will just say, as transparent as we've been, it really is, it really is a struggle for all of us. Like Ms. Ivanchek said, our safety is our paramount goal when we make decisions up here for our children. And I think the work that we've done as a district we've been as transparent as we can. And I appreciate the fact that, the transparency's been there to kind of help answer those questions instead of having people kind of guess, and of course following what they see on social media and things like that. So I truly appreciate that. Okay, so we're going to move around to school board members' business. And Mr. Destin, you are up, sir.
Well, thank you, sir, but I didn't have anything more. I think we've covered a broad spectrum this morning.
All right.
I'm satisfied with that.
All right. Dr. White?
Thank you, Mr. Chairman. Just a couple of things. Since we've been talking about viruses, I just wanted to put in a plug for flu shots. Connie and I went down, and because we're a member of the special risk class, we got the double dose on Friday. So, but I would like to encourage folks that believe in that to go ahead and do that, because that'll be a further complication as we get further and further into the flu season. I do have a question regarding your announcement, Mr. Chairman, concerning I guess opening up our school board meetings, and it may be something that we report back on at a different time. I was just curious, will all the citizens and visitors be coming into this room at the
Can I-
same time?
Yeah.
Or how are we going to maintain social distancing, or are we not going to do that? I mean, where are we at with all that?
Okay, so I can go ahead and answer
Okay,
that for
sure.
you, sir. I just made kind of just an easy statement today, but on Monday, I was definitely going to have everything prepared. We are going to still continue to follow the safe distancing. We're going to set up those rooms. We'll still be doing everything that we can to promote a safe environment, the 6-foot, limited amount of people in here. So we are still going to continue to do that, sir.
Okay, all right.
Yeah, I today
Oh,
kind of
I
made the
understand.
announcement
I
about the
understand.
phone calls, just kind of prepare people, but
Right.
on Monday, we'll definitely have that all out there for you.
Okay, so there'll be a limit to the
Yes, sir.
number of people that are allowed into this room, because I'm just kind of looking around, and some of those chairs don't look like they're 6 feet. But in any case, I guess that you'll develop a capacity, and Mr. Chairman, as this is a school board meeting, I guess that'll come your way in terms of the facility and how it's laid out and
Yes,
all
sir.
those kinds of things. But
Yes, sir.
I just think that's real important, and I appreciate you giving a heads up, and I know you guys are working on that, but I just kind of wanted to hear how we were going to do that. Also, for the public to know how we're
Right.
going to do that we're not going to have doors open and people lined up outside.
Right.
It'll still be a controlled access to this room.
Yes, sir.
All right, very good. Thank you, sir.
All right, thank you, Dr. White. Anything else?
No, sir.
Okay, thank you. Dr. Kelly?
Well, first of all, I'd just like to thank the superintendent and the board members for allowing me to spend that special time with my new grandson, and he is just the most special little pumpkin, so thank you for that. But more importantly, in this moment, even if you could say that, we have suffered some losses in our community of Okaloosa County School District, and I just wanted to recognize a couple, one particular, in my hometown of Laurel Hill, and my alma mater, Laurel Hill School, lost a former student. She was a student when I was principal there. I had the privilege of going to school with her parents. Her parents are both retirees of our family of Okaloosa County School employees, as is a couple of her grandparents, I believe, and her grandmother was Joan Smith, Honorable Mayor of Laurel Hill, who passed away this year as well, and she had several uncles who served and retired in our school district as well, and that's the family of Mary Elizabeth Smith, who tragically lost her life in an ATV accident. But I just think, since so many of her relatives, her parents, grandparents, and uncles served in our district, it's such a loss, and I think it's important that we extend our condolences to that family. And similarly, to continue to keep the family of Colton Ward, student at Destin Middle School, in prayers, who is continuing to be in an unstable condition. So thank you for that, for allowing us to acknowledge those conditions. But on a happier note, I would like to express my appreciation to Board Chair Tim Bryant. I had a meeting I was supposed to attend with ECAR, who endorsed our half-cent sales tax, And I was unable to attend that because I was enjoying that time with our special new pumpkin. So thank you for attending there and for presenting for us. And thank you to those E-Car board members who endorsed our half-cent sales tax. I think that's very important, and certainly a group of realtors who uses the condition of our A-plus ranked school district as great selling points on every home sold in our district. So just thank you to E-Car, and thank you to Mr. Bryant for filling in for me.
You're welcome, Dr. Kelly. Okay, Ms. Vancheck?
Yes. Okay, well, I'm going to shout out to my Gators. They're 6-0. There you go. Got the homecoming this week against Graceville, so they're still hanging in there 6-0. I'm very proud of those Gators. A lot of homecoming activities coming up throughout the district, and I want to, just encourage those students to stay safe and enjoy that special time of high school. Spoke of transportation. I've been visiting our transportation offices and meeting with some of those people, and very interesting, different take on what's going on in the school district from that side, and fun talking to some bus drivers the last few days, and those working out there. Not only that, but the route coordinators and everyone. So appreciate everything that they do to keep those that fleet of buses and those kids safe going out down the road. So a shout out to all of them. Okay, another thing at Baker, this is just amazing. First of all, the Baker's girl volleyball team, they won the district championship, okay? All right, but Kathy Combus, that's the coach there. This is the 18th consecutive year she and the girls have won that. 18 years in a row, they have won that district championship. That is phenomenal. So congratulations to those girls. I know it's not the same team, but it is the same coach and the same school. And I'm so proud of Ms. Combus. I believe this is going to be her ending year with our district. She's ending her career, and I wish them the best as they continue in region play coming up. So I just think that's phenomenal to have that kind of legacy in that. So that's it. So good things going with the Gators and out there. Thanks.
And Ms. Vancheck, I will just tell you that I'm going to give a shout out to the Baker Gators because, as you know, one of the students that I mentor is Caleb Wagner.
Yes.
And Caleb had a fantastic game the other day.
Yeah.
He scored 4 touchdowns on 175 yards on 8 rushes. So
I know, I
for
saw
those
some footage.
for those of you that understand the stats, that's a lot of yards per carry and 4 touchdowns. And as y'all know, Caleb is just a great kid. I really enjoy mentoring him, and if you get a chance to check him out, he's incredible. He's an
Yes,
incredible athlete.
Yep.
And I will just tell you that when you actually get to meet him and see him in person, he is just a good kid, and it's an honor to be able to mentor him. So go Baker.
Yep.
And with that being said, we'll start here with Ms. Gallen. Anything? Dr. Hale? Patrick? Sheila? Okay, this meeting's adjourned.